when you get into the system, it's an incredible system. The service, they got good service and they can fix you up. It is the only difficulty that I've had with it. A lot of people have with it is the time to get to the service. It's a waiting list problem.
We pay our dues to the medical system forever, and I have used them many times, and they've always been very good to me, but I was able to wait for everything else that had to be done. This time I couldn't wait.
Obviously, lots of people get in right away. Lots of times you don't have waiting lists, but in some cases, when you're in serious need, there is a waiting list, and then that creates a worse problem because you get worse before you can get any medical attention at all, and then pretty soon you're a serious case.
My doctor said it was an emergency. It had to be done immediately, and he couldn't guarantee me, like maybe in the next 4 months, 3 to 4 months, he might be able to get me in. And he said, this is serious. The best thing, if you've got the money to pay for it, the best thing you can do is get over the border and get something done.
The one doctor came over and said, well, Mr. McCreath, he says, something's going on in your brain. He says, we'll give you an MRI and we'll look after you. We'll give you a few tests. But he says, I'm going off duty now and somebody else will look after you. So the following day, they started running tests on me, and I was there for 4 days while they were doing all these tests. And my wife and I both asked for an MRI, and we couldn't get an MRI. The doctor says, oh, you don't need it. We did a CAT scan. And he came in on the day that I was leaving and said, Mr. McCreath, he says, I have some good news and I have some bad news. He said, the good news is you have a growth on your brain and it's benign. The bad news is you've had a stroke. I went to a neurologist and she took a look at the CAT scan because we had to go down to the hospital and pick up the CAT scan that they did for us. We picked that up and we took it there, and she says, yes, you have a mass in your brain. She says, this CAT scan really isn't the best. You should get an MRI. So we left there and we came home and we started phoning hospitals to get an MRI. And there's 5 hospitals in Toronto that are supposed to be 724. And we called every one of them. And the earliest I could get an appointment for was May the 27th. And this is back in January, I would say around January the 15th.
The issue in Canada is with waiting lists for diagnostics, meaning MRIs, CT scans, ultrasounds, where you might wait 4.5 months for an MRI. And the other issue is waiting lists for an initial consult and subsequent waiting lists for surgery if you see a specialist. So the system itself is fine. It's getting access to the system that is hugely problematical. What you have to do is apply ahead of time for permission to leave the country to get the procedure outside the country.
I went to Bellingham, Washington, to St. Joseph's Hospital, and really they couldn't have been nicer. When I saw Dr. Coletti on Monday, all he had been looking at was the ultrasound. But he said, this is serious, and it's very bad, and it has to be done immediately. After the surgery, he came in and he looked at me and he said, lady, you were starving to death. He said, your mesenteric artery was 99% blocked. He said, and while I was in there, I found a renal artery to your left kidney, which was almost totally severed. He said, so I fixed it too. But he said, you were just hanging on by a thread.
Now, if you've got a week to live, or hours to live, how could you possibly apply ahead of time for permission to leave the country? You'd be an idiot to do that, because you'd die while you were waiting. It would take 3-4 months for the government to give permission, and by then you might well have got the procedure in Canada, or you might well have died.
We were in Buffalo at the Northtown Images having an MRI done, and it was there for 45 minutes, and we were out of there and back to Toronto. And from there we went to back to the neurologist to show her the MRI, and I had a size of a golf ball on my brain, and she said, we'll have to have that looked after. So she set up an appointment with a Dr. Tucker down in Toronto Hospital, or St. Mike's Hospital. And the earliest I could get to see Dr. Tucker for a consultation, just a consultation, was May the 7th. Was it June the 7th? June the 7th. Anyways, after that, we were at a standstill again. We decided to phone Richard Baker again. He turned around and he arranged for us to go see a Dr. Hopkins in McGill Fillmore Hospital in Buffalo. And that was set up within, I think, about a week and a half. They set up an appointment for March the 5th? 6th. In 4 days, I was out of there, brain tumor removed, and I've been fine ever since. It was a 2 in cancer, which they grade them 1 to 4, and mine was a grade 2. And if I would have waited for the Ontario hospitalization system to kick in, I more than likely would have been a 4 by then.
I wouldn't suggest for the states to go to a 100% public system. I don't think that'll work. If there is a private system that you can go to in case you, like I did, ran into a glitch with the public system, you got a backup, right?
People that are going to come up to my age and find out that they only got this one system and the system fails, they've got no other alternative. Whereas if they have private enterprise, like insurance companies, or somebody that they can turn to say, well, I'm going south of the border, I'm going to go to England, or I'm going to go to Germany, get myself looked after, and try to stay alive.
No system's perfect. Certainly the American system is not perfect. I think it's better than the Canadian system. I think a meshing of the two systems, the good aspects of the Canadian system, the good aspects of the American system, would be a killer system. But I think if the Americans were to adopt holus bolus, the Canadian system, it would be a stunning error, a catastrophic error.